Welcome back to Great Day, Louisiana. Usually when I come out to physical, I'm the one working with the physical therapist to do the fun experience. But look, today is a little bit different. Why, you ask? Because today we are focusing on dry needling. Joining me now to talk about what dry needling is and the benefits of it is the wonderful Cindy Tallis. She is a wonderful physical therapist here at Fyzical Therapy and Balance Centers. What's up, Sydney?
Hey, Malik, how you doing?
I'm doing good. I'm super glad I'm not the model today. Shout out to Emma. She is going to be our model today. She is a tech here. Okay, I have to learn about this. Dry needling. I'm scared, but I'm interested. What is dry needling?
So essentially, dry needling is where we take a thin monofilament needle, meaning it's not injecting anything into the body and it's not taking anything out. What it's doing is it's going into the muscle that's affected, usually in a trigger point, and it's going to make a change at that muscle to reduce muscle tension, help promote healing, and help your body release its natural form of pain relief to reduce your pain.
Is it different from acupuncture at all?
Yes. So while they both use a similar needle, acupuncture is going to work along your body's energy meridians in order to realign your chi and reduce pain and cause other effects. Whereas dry needling, we're going directly into the tissue we're trying to make the change in.
Come on. Well, I'm excited to see how this all works. Like I mentioned, Emma's going to be our model today. She's going to lend us her whole arm. Okay, how do we get started here?
So first thing we'll do is after a quick exam, I'm going to identify the areas that need to be treated. So in particular, I'm looking for any sort of taut bands called trigger points that might cause her to flinch or might feel like a little bit of a knot. Essentially, if you've ever been at home and you have a spot where you're like, ooh, right there, that's where it's really bothersome, that's the type of places we're looking for. So once we identify those areas, we'll cleanse the skin.
And while you're cleansing the skin, what sorts of conditions does dry needling help with? Is it any type of painful condition?
Really great for tendinitis, really great for if you've just got that really tight muscle that won't let go. Works great for neck pain, especially if you've got headaches. Can be great for sciatica as well. So if you ever get that numbness and tingling going down your leg, can be great for those. And really most aches and pains you have, it can be great for.
Got it. Now I'm sure everybody wants to know, how big is the needle? How big is it?
So they're really, really small, especially in the area I'm going to do with Emma today. It's not very long and they're teeny, teeny, tiny. On average, they're about 1/8 of the size of a normal shot needle.
Okay,
so if you think about getting a flu shot or anything like that, it's about 1/8 of that size.
Got it. So what are we doing right here?
So, all right, Emma, what I'm going to do is I'm going to place the needle on your skin and I'm going to just tap it in. So what she's feeling is she might feel like a little dull and achy sensation. She's essentially feeling like a little needle stick. So if you've ever pricked your finger to take your blood sugar or anything like that, it's a similar sensation. And then usually you don't feel it too much after that.
Now this is something that is treating pain. How is this different from maybe just like a pain pill? Why is this the option to go with?
So first of all, it's non-addictive. So like a lot of opioids or serious pain medication like that, it can have addictive qualities, right? The other thing is this is actually working on a muscular level to help affect a change there and really promote long-term healing, not just masking the symptoms.
So once you put the needle in, what's happening on the inside? It's releasing something?
Yeah, so your body essentially is going to respond by promoting blood flow to the area because I am causing a small injury to the area by poking into that muscle. Your body's going to respond like it would any other injury. So it's bringing blood flow to the area to heal any scar tissue and things like that. It's also promoting that trigger point or that taut band to release.
Fascinating. Now I see you have 3 here. What other parts of the body can dry needling work on?
Really any part of the body. We have great results with something like this, which would be for like a lateral epicondylitis or a tennis elbow. We've got great results for neck pain in your neck or headaches alongside that, in your lower back, knees, ankles, feet, really any area of the body.
Now what's the recovery time like once I get punctured? Safely, of course. How long am I out before I can start doing something again?
There's really no recovery time associated with it. Some patients feel pain relief immediately. Some people it takes a day or so to kind of kick in. Usually the worst side effect is that you're going to be sore possibly for about 24 hours, but after that soreness goes away, you usually kind of start feeling the benefits.
And you know, you mentioned so many common conditions that so many people have. Tennis elbow, tendinitis. How do we know if this is the treatment that we should go with over something else?
Well, it depends. One good thing is, or one good way to look at it is if you've been getting treated with other things, especially for some of these chronic conditions like tendinitis or just chronic low back pain, chronic neck pain, and you're just kind of stuck and don't know what else to try, give it a try and see if it works for you. The other ways that we look at it is if you have one of those chronically tight muscles, it's just like, I can't get in there. I've been massaging, I've been getting like maybe massages professionally, I've been stretching, I've been exercising, and it's just not getting any better. Try dry needling because it's a great way to get deep into those muscles to make that a change.
Now I see we have a contraption right here as well. When when can we use this, and what is the benefit of this?
So this is an electrical stimulation unit. Essentially what we'll do is we'll connect it into the needles, and it's gonna send an electrical current into that muscle to help it penetrate a little bit deeper. So as I turn it on, she'll just feel a little bit of a tapping sensation. So let me know when you start to feel it. And you'll start to notice that muscle kind of pulse a little bit in some situations too. Essentially, it's just helping that muscle get even more benefit from the needles.
And how long is a session like this usually? Because look, Emma is a trooper, everybody.
So we typically leave the needles in for about 10 minutes. However, you still get a lot of benefit from just the insertion of the needle as well.
And how often is a session?
We recommend at least once a week.
Once a week,
Yeah.
okay. And how early and how fast can we see the results? Literally after the first session?
Some patients see the results as soon as we take the needles out.
Oh my goodness. Well, look, Emma is not even flinching, everybody. Not only does she work here, but this is her first time getting dry needling done, and she did great. And Sydney, thank you so much for the great explanation. Congratulations, Emma. Woo! And look, everybody, here's the good news. If you want to try dry needling, guess what? Fyzical Therapy and Balance Centers is giving away a free needling session. You heard me, for the month of January. To qualify, all you have to do is call 504-861-4693. They have 3 locations, one uptown, one in Chalmette, and one in Metairie, which is the one I am here at today. For more information about all the things they offer here at Fyzical Therapy and Balance Centers, log on to fyzical.com/new-orleans. We'll be right back.